Curious kids love to put things up their nose. What are the biggest culprits? Well, here's a list of the 10 top things most likely to be shoved up there according to babyzone.com. Crayons, beads, French fries, fingers, marbles, spaghetti, tissues, Cheerios, small toys, beans, and peas. We spoke with a few of the specialists at Lake Ear, Nose, and Throat and Facial Plastic Surgery about the special way they treat their youngest patients.
My approach to treating a pediatric patient is treating them like they are one of their own. They're not just the child. You don't only talk to the parents, you actually talk to the kid on their level. And you ask them, where does it hurt? And they actually will usually give you different answers than the parents will. I usually don't wear a jacket, so that makes them feel a lot more comfortable. And kind of just explaining it to them on their own level, exactly what's going on. And most of the time you do earn their trust and they're willing to come back and they'll open their mouth nice and wide for you without fighting with them the whole time. So they really enjoy that you actually treat them as an individual. Foreign objects in the ear, especially for kids, are always interesting. I've had Play-Doh in the ear. The parents only find that out when they go to the doctor's office and they tell them there's something in their ear that's blue. And sure enough, the kid comes in and I ask him, so what'd you put in your ear? They're like, Play-Doh. I'm like, when'd you do that? A couple days ago. And they'll give you all the answers, whereas they look at the parents like, I don't know, I didn't do it, don't get me in trouble. When I worked in Tampa, there's Gasparilla, so tons of beads in the ear. We would see that all the time, and as long as we're usually the first ones to get to it and someone else hasn't tried to manipulate the ear, the patients do very well. I've had 2-year-olds just sit there and then they're all excited when you get it out and they can see what they had in their ear. So they do very, very well. Q-tips. It's probably the vein of my existence. Q-tips cause so many problems. From what I think of the worst problem is when I get little kids in here who have jumped off something with a Q-tip in their ear and they have now basically ruptured their eardrum and caused hearing loss. So for me, that's very scary to have around children. But for adults, everybody thinks that it's actually used to clean their ears and get all that wax out because it's bad. Wax is actually good. It should be in their ear a little bit. Some people do overproduce it and do have to get it taken out, but they should just use a wet washcloth. But they can cause so many problems, especially someone who's diabetic. They can cause a very serious ear infection that may take a long time to heal. So for everybody, do not use Q-tips.
For appointments and more information about Lake ENT, its services, and its team of specialists, click the Hidden Gems story link on our homepage, yourhometownhealth.com.